Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Cancer Buzz has been reporting from Austin all this week at the ACCC 40th Annual National Oncology Conference. One of the big topics this week and on everyone's mind is strengthening the oncology workforce. Here with us now is Karline Peal. She's the Associate Operating Officer at Vanderbilt University Medical Center. Karline, thanks for stopping by.
Well, thanks, Summer. Thank you for having me.
You have a presentation today titled How Technology Can Support, Not Replace, the Healthcare Workforce. It's an interesting title. What do you think is the current sentiment about technology in our industry? Are we hesitant of the unknown?
Wow, I think we're just at the starting gate, and everyone's looking out to say who's going first and how fast and where are we going. So it's really exciting times. I think we just came off the pandemic, or we're probably still in it, but we all think we're out of it, and we're starting to look at back to normal operations. What are our capital investments? Where are we going to put our time and energy back into? And so I think we're all at the same place. We're at the starting gate, and we're looking to see how it's going to improve our workflows and efficiencies. I think there's a lot of talk every time you turn the radio on or read an article is how AI is going to replace jobs. I think there's a lot of buzz, but when I think about when we've implemented technology in our work, we haven't replaced workers. We're supporting our team, and we're supporting the work that they do. There's a huge administrative burden that continues to be added year over year with just different accreditations and standards and requirements and quality delivery that we have to meet. So I think just reducing a lot of the redundancy and administrative burden on our staff will help with retention and turnover and ultimately just lead to better patient outcomes.
So you're saying the goal is to get technology to help us so we can focus on our patients.
Mm-hmm, absolutely.
If we fully relied on what it could help us do at this point, can we improve that patient experience?
Oh, definitely. I think we're doing so each and every day. Part of my talk will talk about how, the consumer looks different than it did before the pandemic. I know when I started at Vanderbilt, there was kiosks in some of the lobbies. And I said, well, what are those things? Oh, we don't use them. And they're collecting dust. I'm like, oh, well, we should just remove them. Well, the pandemic happened and we didn't have time. And now we've moved back to virtual check-in. People want to be able to do things, they check in for their flight before they even arrive at the airport. They want to do that before they arrive to the hospital. They want to move through their appointment quickly. So we've implemented the virtual check-in desk. And we still have people there. I think there's that sentiment of, oh, well, I'm going to miss Susie and saying hi to her and seeing how her weekend was. We still have that. And if anything, we're thinking about it more of a concierge model of how we can support our patients differently. Maybe we're talking to them a little bit more or walking them to their next place, or the employees are back working on some of the tasks that they need to get through to schedule the next appointment and whatnot. So we're not replacing workers. We're finding more quality work, and they're finding more joy in their work.
Which is why they got into it in the first place.
Mm-hmm, absolutely.
What about the flip side of that? Is removing the administrative burden that you were talking about and increasing the satisfaction and well-being in our own jobs as healthcare professionals, can it help us there?
Oh, yes, absolutely. I think, we all want to work smarter, not harder. Wouldn't it be glorious if the workday was shorter, right? So I think, again, how do we reduce those administrative burdens, clicking through multiple times to get to the next task. So we've implemented some bots to move through things quicker. If we can eliminate some of those additional clicks to just process things quicker and faster, we're doing that. And when you think about the next generation of the workforce, it looks different than it does today, right? They expect things to happen fast. They expect things to happen rapid with their fingers and moving quickly through things. So they don't want to sit and process a check-in appointment or even documentation for 20, 30 minutes. They want to move on and take care of patients because that's essentially why they went into healthcare.
Thank you, Karline.
Mm-hmm.
Cancer Buzz will be back later today with more news from the ACCC 40th Annual National Oncology Conference. Until then, I'm Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.